end of the day, Shivangi, the decision for home-based care versus intermediate care is made by the medical officer of health based on the guidelines, right? But there is a selection criteria. So, for example, people between 2 years, above 2 years, and below 65 years of age, right? If you have a well-controlled, you could have multiple medical complications, in the sense comorbidities such as diabetes, high blood pressure, kidney disease, heart disease, but they should be well controlled, right? If they are well controlled, then potentially you could be managed as a home care. I mean, you're suitable for home isolation, but those patients who are in an immunocompromised state. So, for example, what do I mean by an immunocompromised state? Those who have active malignancies or cancers, right? Who have organ transplant recipients, right? Patients with any immunodeficiencies like HIV, right? Or if you're on any or if you're taking any medications that can suppress your immune system, right? So, for example, people on long-term steroids, right? Or chemotherapy, right? Those patients are not suitable for home-based care, right? The other thing, in terms of pregnant women, usually the cutoff is 24 weeks or less than 6 months, right? If you're more than 6 months, you're not suitable for home-based care. And your BMI. So when you talk about your BMI, your body mass index, because it's what, for your height, what your ideal weight should be. And those patients who have a BMI of more than 30, then they are considered high risk, and generally they are not suitable for home care, because the reason for that is we've seen that the complications of COVID are more in those patients compared to somebody with a lower BMI. And then there are also you have to have your home environment needs to be suitable. So, for example, what do I mean? The patient should be able to be isolated. He or she should be able to be isolated in a room, right? Preferably with an attached washroom, right? They should be able to care for themselves, or have someone who is able to care for them, and there should be kind of a communication channel open, where they can, either through telemedicine or some form of or through a phone, where they can be in touch, right? So these are what we call the selection criteria for home-based care. Now, if a patient does not meet the criteria, then they're considered high risk, and they should be admitted to an intermediate care facility. So, to answer your question, what we are seeing now, or what we have seen in the past, is a lot more patients who are suitable for home-based care seeking care in intermediate care facilities. And I think that's what we need to advocate and say, look, if you are able to be managed at home, and if you're suitable for home-based care, then we would prefer if you could do that, because then you're saving a bed, and you don't occupy a bed unnecessarily, and somebody who is in the high-risk group who really needs it could get a bed easily. Because what is happening is we're seeing patients who need to wait for a day or 2 or even 3 days to get a bed at an intermediate care facility.